that we have been working on for some time. I think we have all of our panelists and speakers here, and I know members of the press have joined us as well. And I want to be respectful of everyone's time, so I think we'll go ahead and get started if everybody is ready and prepared. First of all, I want to thank Tim Robinson and Nationwide Children's Hospital, Dr. Dixon and her team at Columbus City Schools. Councilmember Tyson has been an incredible advocate and partner in this work, and really grateful for her. Joy Bivens, Director of Franklin County Job and Family Services, thrilled to be partnering with you on another important effort here in the community. And Linda Myers, teacher from Medina Middle School, who's going to share some perspectives this morning. In February, at my State of the City address at West High School, I laid out an equity agenda to call out racism and discrimination wherever it exists and our plans to address it. It includes all aspects of our community. It means working to reduce evictions where we know Black mothers are disproportionately impacted, and increasing the affordability and availability of housing. It means creating more opportunities for Black-owned and women-owned businesses to have equal access to city contracts. It means connecting residents to good-paying careers in the trades. It means ensuring access to high-quality pre-K regardless of your zip code in this community. And it means reducing infant mortality and helping more women and their children have better birth outcomes and thrive in their earliest years of life. CelebrateOne and all of its partners have been working on this effort since 2015, implementing the recommendations of the Greater Columbus Infant Mortality Task Force. Reproductive teen health education is an important part of this because preventing unintended and unplanned pregnancies helps avoid preterm births, the leading cause of infant mortality, and all the socioeconomic stressors to young mothers, such as housing and food insecurity, unemployment, transportation. Consider this. Teen pregnancies in which the mother is between the ages of 15 and 19 account for 4.5% of all pregnancies in Franklin County. And we know the evidence shows that decreasing unplanned and unintended pregnancies increases school attendance, increasing a student's chance of graduating from high school on time. One of the most important steps for our youth. And we know all the research and studies show that if women wait just until their 20s to start families, that there's a significant increase in better birth outcomes and a greater chance that that child, that newborn child, will not face the struggles of poverty. We know that working together, we can help the women, the young girls and women of our community and their children have a better and brighter future by working together on this effort. So I'm excited about the announcement Nationwide Children's Hospital is making today that adds to dollars provided to the public-private partnership working to increase access to reproductive health education in our community. $250,000 of CARES Act dollars from the city, public funding from the county, private funding from AT&T, Women's Fund of Central Ohio, and the Columbus Foundation. A great public-private partnership focusing on our policy goals of empowering and strengthening women and better preparing our young people for their futures. It's now my pleasure to introduce one of our great partners on this effort and so many efforts throughout our city, Mr. Tim Robinson, CEO of Nationwide Children's Hospital. Tim?
Thank you. Thank you, Mayor Ginther. One of the most important turning points for infant mortality came when you, as City Council President, elevated the issue with the area's civic and community leaders back in 2013. This work simply couldn't happen without the partnership of the City of Columbus, the County of Franklin, and CelebrateOne, and so many others who care about children's health. I'm very happy to be able to talk about deepening those partnerships. In 2019, Columbus City Schools began working with CelebrateOne and Nationwide Children's to provide evidence-based, comprehensive reproductive health education for 7th graders in the district's middle schools using a curriculum called Get Real. Mayor Ginther was once again instrumental in this, and the effort has been spearheaded by CelebrateOne's Teen Reproductive Health Education Committee, a coalition from the public and private sectors that are working to improve reproductive health knowledge among youth in Franklin County. I'm excited to announce that Nationwide Children's has been awarded a 3-year, $2.5 million grant from the U.S. Department of Health and Human Services Office of Population Affairs to support and extend this work and offer other school-based health services for adolescents in Columbus City schools. The grant will allow Columbus schools and CelebrateOne to expand the Get Real curriculum for more middle schoolers, and it will make possible the creation of other initiatives, including student peer ambassador programs, parent programs, and summer programs. The grant will also help Nationwide Children's provide more health services to the district's middle schools, like those including our traveling mobile care center. We will also be establishing a new school-based health clinic, bringing the total to 12 clinics in the district. We anticipate that during the 3-year period of the grant, a total of more than 7,000 7th and 8th graders will be positively impacted. And all the partners want to measure the exact impact we'll have. So we are collaborating with The Ohio State University's College of Education and Human Ecology. Eric Anderson, a professor of education psychology, will partner with Mary Kay Irwin, our director of school health at Nationwide Children's, on the evaluation and research and impact of the effort. This grant will help us all take another step forward in our joint efforts to tackle the issue of infant mortality and to improve the health of Columbus's youngest residents. These are the kinds of steps that we can take now that will make a difference far into the future. I now have the honor of introducing one of the key people driving these initiatives, the superintendent of Columbus City Schools, Dr. Talisa Dixon. Dr. Dixon has her hands full running Ohio's largest school district in these really difficult and unusual times, but she and other leaders of Columbus City Schools are continuing to make reproductive health education and access to health services a priority. This has not always been a traditional role for schools, but Dr. Dixon has helped show how important it can be. So Dr. Dixon, I'll turn it over to you. Thanks.
Thank you, Dr. Robinson. I think what's important, as you stated, that partnerships are key. And thank you for the years of partnerships that we've had with Nationwide Children's Hospital. We're excited. Columbus City Schools has continued to not only focus on partnerships, but equity and access to various programs. And that's why partnerships like these are so important. Over 7,000 of our students will be impacted by this partnership. We are seeing a decrease every year in the number of teen pregnancies of our CCS students. And this collaborative partnership started in 2017, and as we identified the need of a comprehensive plan for reproductive health education for teens in Columbus City Schools. The collaboration also identified the best way to accomplish this by using evidence-based curriculum. A partnership with community partners, providers, and CCS to provide the educational needs across the district. And that is so important for our students and who are future residents and leaders in our city. We had a pilot program. The pilot program was going really well, even though it was interrupted by the pandemic. We were excited to have that program in our schools. Our CCS nurses will be available for parents and student support, providing health counseling, referrals, and linkage for healthcare, and will work closely with Nationwide Children's Hospitals to provide comprehensive services to our students. So again, you have the commitment of Columbus City Schools with this partnership, and anything that we can continue to do to strengthen the partnership, you have our commitment. And thank you, and we're excited to expand these services to the students of Columbus City Schools. And now, at this time, I will introduce Priscilla Tyson, Columbus City Council member.
The introduction. I am pleased to join this collective today. Sorry. I'm pleased to join this collective today with Mayor Ginther, Tim Robinson from Nationwide Children's, Dr. Talisa Dixon, Joy Bivens, and Linda Myers. The $2.5 million grant from the to Nationwide Children's Hospital has been received to expand the school-based adolescent program. Healthcare services is a win for the city of Columbus and for our students. It will allow our students to have successful futures and the achievement of a high quality of life for Black girls in Columbus. Ultimately, to change the trajectory of Black women, we have to start early in the lives of creating opportunities to help them to improve their futures. This grant will provide a life-changing education. 2 years ago, I created the Commission on Black Girls because of the disparities that Black women experience in our community. The commission was charged with studying the quality of life of Black girls ages 11 to 22 in Central Ohio. And so from that information, we have learned that as of July the 30th of this year, we released its report on the quality of life of Black girls in Central Ohio. The report includes one overarching recommendation with 3 strategies and 18 additional recommendations. What we found is that, of the 164 girls that reported being sexually active, almost 50% of them said they had sex before the age of 16. The report also stated we polled 422 girls were surveyed. 14 of the zip codes had representation of 10 or more girls. And many of those girls that took part in the survey reside in CelebrateOne priority neighborhoods. The Center for Healthy Families shared with the commission that 5,200 teen females were pregnant or parenting in 2014. While teen pregnancy rates have fallen across the United States, Black teens ages 15 to 19 are 2.5 times more likely to get pregnant than white teens. We understand that parenting and pregnant teens face substantial economic and social consequences. In addition, data from Columbus Public Health demonstrates that Black girls 15 to 24 are more than 1.5 times more likely than their white peers to have babies born with low birth weights, and nearly 3 times more likely that those pregnancies are terminated. During a recent 4-year period, 75% of chlamydia cases and 67% of gonorrhea cases reported to Columbus Public Health occurred amongst 10 to 24-year-old African American females. Now, we can look at this data and assume that girls are behaving recklessly or immaturely. However, the commission heard from girls in one of our listening sessions and many others that they are in need of education. The girls told us that there are many aspects of hygiene and reproductive health that they just don't understand. What we heard from the girls underscores the need for enhanced services that Nationwide Children's Hospital, in partnership with Columbus Public Schools and working along with CelebrateOne, we will now be able to offer. I'm grateful that our students will now have this resource, and I support all that we can do to continue expanding reproductive and physical health education. And now I have the honor of introducing, I think I have Linda Myers, Linda Myers, the health and wellness teacher at Medina Middle School, and she will share a personal story and data regarding this initiative.
Hi there. First of all, I want to say thank you so much for including me in on this celebration. I want to thank the panel I mostly want to thank my principal, Mrs. Charmaine Tinker, for having the foresight and the leadership to allow me to bring this program in. New programs are usually met with a little bit of question mark. And I want to thank Dr. Dixon and Nationwide Children's Hospital for also having the foresight. Just to give you a little quick background on how it went last year, we were one of the 4 pilot programs. And it was met with a little bit of resistance. I had 2 7th grade classes. We were meeting in a classroom instead of the gym. And so when you take away gym and activity time from the students, they aren't real happy about it. So the first 2 weeks, we had a little bit of pushback. We had 2 great instructors come in, and we collaborated right off the beginning. The students made class rules. We made it a very safe and fun environment. By the 3rd week, the kids had bought in. They had bought into it. They looked forward to it. In fact, they were even reminding me when I said, see you tomorrow on a Wednesday. Oh, Miss Myers, we've got the sex ed get real class. Yep, that's right. So they were buying into it. The instructors covered all the topics that are necessary. There's probably even more that are necessary. It was even a little uncomfortable, which I always think is a good thing. And what that brought out was a trust in the classroom amongst peers. It brought out a trust. I had many students open up in front of each other, and that's a difficult age. They like to make fun of each other. And they were so mature, even when laughing. We made rules about when you can laugh, how you can laugh. But I think the biggest takeaway for me was I had many students confiding in me after class, during lunchtime, sending me notes, talking to me about their personal situations. And as a teacher, that's the biggest honor you could ever have, is when the students completely trust you and come to you. So I wasn't real comfortable on some of the topics, and I had to pretend. But it's important information, and I so look forward to continuing the program. And the last thing I'm going to say is it got around in the school. They knew it. When the physical education class walked out of a classroom, they knew what was going on. They told their friends, and it stirred up a good interest and a curiosity. So I so look forward to continuing this. Thank you.
Thank you so much, Linda, for your perspective and incredible service. Thanks for your service to children and families of Columbus City Schools. I want to make sure we recognize and ask Director Joy Bivens, Director of Franklin County Job and Family Services. We wouldn't be here today, and quite honestly, wouldn't be here on so many different levels without her leadership and partnership. Certainly, we spoke earlier about how this work is going to impact families and children today and tomorrow, and certainly aligned with she and the commissioners Rising Together plan as well. So, Director, thanks for joining us. Thanks for your leadership, and I want to offer you a chance to share a few remarks.
Thank you so much, Mayor. Thank you, Councilmember Tyson, Dr. Dixon, Ms. Myers. I'm so happy to be here on behalf of the Franklin County Commissioners, Commissioner John O'Grady, Commissioner Marilyn Brown, and Commissioner Kevin Boyce. We know that reproductive health education can be a game changer. It's important for young people during a crucial stage during their development. It's vital to closing health disparities, and it supports the mission of CelebrateOne. Our commissioners and our agency have committed more than $2.7 million toward the mission since its inception, promoting the importance of safe sleep, distribution of free cribs, and funding a variety of community-based initiatives. Over the last 2 years, we've provided over $200,000 to begin piloting the Get Real Teen Reproductive curriculum in 5 Columbus City schools, including Medina Middle School, where we have heard from Ms. Myers. But make no mistake, These are also anti-poverty measures, expanding access to evidence-based reproductive health education and supporting school-based health clinics, which are a pair action and steps directly identified in the Commissioner's Franklin County Rise Together Poverty Blueprint Plan. It is worth pointing out that these action steps aren't just what experts and academics suggested. They are actions that the community asked for. We spoke with more than 200 residents in developing the blueprint, many of those residents living in poverty, and developed the goals and action steps towards the plan. Franklin County is proud to have helped to lay the foundation that this grant will build upon, and we pledge our ongoing support. So again, thank you, Mayor Ginther and the rest of the panel.
Thank you, Director, for all of your work and commitment and partnership. I think we've heard today all of this align and tie together quite well, from the leadership of the county to Councilmember Tyson with Commission on Black Girls, from Dr. Dixon, and then some powerful words from Linda. And want to thank her again for her boots on the ground perspective on the Get Real curriculum. And thanks to your commitment as a teacher for dedicating your career to our young people. I think what came through clear for me this morning, and particularly from the stories that Linda shared with her students, that empowerment for girls and women comes through education and evidence, not silence and shame. And so I'm excited about this partnership and celebrating this award to Nationwide Children's. Very excited about what work this is going, the impact this is going to have on our middle school students here in the community. We'd be happy to answer a few questions from the press. I know members of the press have joined us. I want to make sure I recognize some other folks who are on the call who know a whole lot more about the details of the program, and great partners of ours. I want to make sure I introduce them because they may end up taking some of the more difficult technical questions if we get them from the press. And so I want to recognize them. Mary Kay Irwin, Director of School Health Services at Nationwide Children's Hospital. Dr. Eric Anderman, Professor of Educational Psychology, College of Education and Human Ecology at The Ohio State University. Sarah Saxby, Health Education Project Manager at Nationwide Children's Hospital. And Kate King, Director of Health, Family and Community Services at Columbus City Schools. For members of the press, you should have received instructions via the media alert, but let me just go through them quickly. You should see a hand button next to your name. Click on that to raise your hand. We'll unmute you one at a time to answer your questions. Be sure to unclick the hand after we've answered the questions, and you can click it again if you have another question or a follow-up. And if you would, let us know your name and news organization when you ask your question. We have our first question, I believe. Is this Ms. Tanisha Johnson?
Yes, Tanisha Johnson, reporter with Spectrum News. Good
Great.
morning, everybody. Question is for Ms. Myers. Just wondering, you talked about how you noticed that conversation opened, students were more open to having conversation, but I'm wondering in terms of maybe students talking about making different choices, did you find that students started talking about that, and what choices did they start to make that were different, that maybe changed the path that they may have been going down?
That's an excellent question. A lot of kids shared with me privately that they had some experiences that they didn't understand that they actually had a choice or had a say in. Other students talked to me, about learning to say no, learning, what does cause pregnancy. There's different myths out there about what causes it and not. We had conversations, and I was advised not to get too specific because I don't want anybody to feel that their information was shared. But you know, it covered a lot of things about the sexuality, gender identification, sexual orientation, and, you know, like I said, the class climate went from laughing and giggling to respect. And I don't think I could have asked any more of them. So these are ongoing relationships and conversations. And as a teacher, that's all I could ever ask for.
I think that's also a sign of a great teacher that creates the culture and the climate for that type of conversation that is not always the easiest for young people or certainly for adults with young people to talk about. So thank you, Linda. Are there any other questions from the press? I think see Earl Hopkins.
Yes, Earl Hopkins from the Columbus Dispatch. So I'm curious. So I'm new. This is my first week. So forgive me for some of the more simpler questions. I'm not really familiar with the initiative, but maybe Superintendent can speak to this. How will the Get Real program or initiative kind of be administered fully with this grant set in place?
Thank you. That's an excellent question. And I am going to introduce our Director of Health Services, Dr. Kate King, to answer that for you. And then she may defer also to Dr. Mary Kate to assist. So Dr. Kate King?
Hello, thanks for having me here today. Thank you, Dr. Dixon. So we've been working really closely with Nationwide Children's Hospital and our other partners in our pilot program. And again, the grant is going to give us the opportunity to expand that, not just to a small pilot of 7th graders, but to expand it to 7th and 8th graders. And then also expand healthcare from those referrals and from those students understanding and parents understanding the need for reproductive health care. Our school nurses work really closely with our school-based health centers, and I'm so excited that there's going to be a 12th school-based health center. And what we have in place is that in these classes, we have our health education teachers and our partners teaching in these classes with the ability to refer any of the questions and any needs to school nurses who then link them with the services that we're providing. Dr. Irwin, would you want to answer more about that as well?
Thanks, Kate. Yeah, I would also just add that in addition to the new school-based health center, we are also going to be directing our mobile care centers to the middle schools. So where we are providing this education that students can really easily access care for those who do not have a medical home. Additionally, we'll be kicking off the Peer Ambassador program in these schools, which is really a youth-informed program that improves health behaviors and positively engage our youth to be peer models and motivators. And then also want to make sure we don't leave the parents out. So this grant's going to allow us a lot of opportunity to launch some parent engagement sessions, really with the aim to uphold the spirit of healthy family communication and to partner with parents to strengthen healthy behaviors of their children. And then round it out with the summer experiences. So we intend to partner with community agencies that already have create safe space in the summer months where we can really leverage the Get Real curriculum and our experts to reach more children.
Thank you for those responses. Are there any other questions from the press? Mr. Hopkins, do you have a follow-up question?
Yes. So what time frame is this initiative to go fully in swing? Is this kind of a next year thing, or is this something even further down the line you all are anticipating on implementing fully?
Should we turn to Dr. King or to Mary Kay Irwin on that?
I'd be happy to take that. So let me also clarify that we intend to continue the community collaborative that has been ongoing. So we will continue to work with Columbus City Schools and the Teen Reproductive Health Committee and all the partners engaged to continue to offer the Get Real curriculum, for example, that with Linda Myers and her colleagues that have already received the service. So that is just ongoing. What this grant does is really boost that effort in a number of ways as we've described, but from a timing perspective, we are officially in a 6-month planning phase. And then we will be launching this more robust outreach beginning in January. And then we are funded to carry that out for 2 additional school years. And there are measures built in the grant for sustainability so that when the grant funds are over, the intention is that all the work can in fact continue.
I think we have another question from Ms. Tanisha Johnson.
Yes, just real quick, wondering if this program, do you see it as serving as a pilot, not a pilot, but a model, not simply here, in the Columbus area, but for other districts across the state and across the country?
Well, I'll say a quick word and then maybe turn it to Councilmember Tyson to see if she has comments. I know she is a great leader with the National League of Cities and works with local leaders not only around the state but the country. So she might want to add something to this. We certainly believe that an evidence-based, culturally competent, comprehensive reproductive health curriculum is a critically important part to our development of young people. Councilmember Tyson and others have spoken to the disparities, and so we are laser focused on this, thinking, particularly women, young girls and women in our CelebrateOne opportunity neighborhoods, and particularly girls and women of color. And we believe that we can build a national model in partnership with the school district, with Nationwide Children's Hospital, that can serve as a model for other communities around the state and country. But Councilmember Tyson, Dr. Dixon, would you like to share any words?
Thank you, Mayor. I absolutely believe that the partnership between Columbus City Schools, Nationwide Children's is certainly a model that we should look to for other cities across this country. Certainly, as we're looking at thinking about our girls, and especially either, girls of color. Also, when you think about areas where you may have girls in areas where there may be an Appalachia that they are in need of these types of services. The teen reproductive health, this education really aligns with us we had this recommendation in the Commission on Black Girls, and they were stating that we need to advocate for more health education, food, exercise, reproductive health. And so the Commission on Black Girls report is certainly the first report that's been done in the country where a city has really studied the quality of life for Black girls. And so in alignment with this report, with the work that we have just discussed today, I absolutely believe it is a national model.
And thank you. I echo that. I don't take lightly that I was once a Black little girl, and as a Black female that's leading the largest district in our state, this is an opportunity. So yes, we will be a national model because we understand that there are health disparities, and we want to make sure that we provide equity and opportunity for our youngest residents to be provided quality healthcare that's curriculum based. So they understand the importance of the decisions they make, and they understand the importance of taking care of themselves. And this is timely. Is something that has been in making. Of course, we talked about there have been pilot programs, but I am proud to say that the city of Columbus, the school district in Columbus, and Nationwide Children's Hospital are joining together and saying this is important. It's important for our students. It's important for our residents to say that we have equity for all. And that is, I think, a message in itself. And I think we're going to be a model to show other cities how it is done and done well. And when you bring in the school district and you bring in a curriculum, people have an understanding of the why. It's not this is happening to me. I understand the importance of it. And you're starting early, and these are lasting message and lessons that our students would take with them forever. So again, kudos to the city, kudos to Nationwide Children's Hospital. This is a moment in time to continue to focus on our students and do it together. Partnerships are important, and this is yet again another example of the city partnering and being very intentional about its partnership with the students, with the school district and healthcare providers. So thank you.
Thank you, Dr. Dixon. I don't think we have any final questions, but I do want to offer Tim Robinson and Director Bivens kind of the last word this morning, because quite honestly, we wouldn't be here without the county and the leadership of Nationwide Children's Hospital. Maybe a little bit more to Ms. Johnson's question. How can this serve as a model potentially for counties and for children's hospitals around the country? And I'll turn it to Joy and then maybe ask Tim to close us out.
Issues such as health disparities and even issues as it relates to poverty issues. I'm looking forward on behalf of the commissioners, our county administration, I'm looking forward to our community continuing efforts like this so that we can continue to strengthen families and close some of the gaps that have been plaguing our community for years. So thank you again, and look forward to working with you all soon.
To the commissioners. Tim, you want to close us out?
Sure. So I would just point out that one of the elements of the grant is that it has an evaluation and research component. So we will be measuring the outcomes, and then we will be publishing those results and sharing them with peers throughout the country. Our commitment, what we know is that social determinants of health has a far greater impact on the full potential of children and their overall health status. And that's why we are so pleased to be part of this partnership with your leadership, Mayor, and CelebrateOne and all the efforts, along with the county and the school district. It shows the Columbus way, our ability to come together and tackle these very difficult issues. I think we've made tremendous success over the years, but we still have lots of challenges to address, and most importantly, those disparities that we're still really pursuing. So again, thank you all for your leadership, and it's been our pleasure to be a part of this.
Thank you, Tim, and thank you to everyone that's joined us this morning. If there are any additional questions from the press, you can follow up with the communications office here at the city, and we'll get you either connected with or get you the best information that we have available. Thanks, everybody, for your time this morning. Have a great day.